Slides going here. So I have the pleasure to talk to you about adult autism research today. And, in research focused on adults, there's a lot of focus on adult milestones, finding jobs, establishing meaningful relationships, maybe even finding a long-term partner. And certainly emphasis on living independently, and even more so recently, maintaining physical and mental health. But what's interesting is that if you actually look at the dictionary, adult has a few different definitions, but none that I found actually mention any of those particular milestones. So to adult, as a verb, focuses on behavior and really emphasizes accomplishing the mundane, sort of necessary everyday tasks, not on making any kind of major accomplishments. So when we look at autism research that highlights adults having challenges in these different areas, the problem is that the focus is often on an outcome. So we don't know the details of how those who maintain competitive employment really succeeded, or what are the specific barriers to maintaining engagement in the community. So this is a big problem because if we want to tackle these bigger issues, we really need to know more about those details and how to support adults in their day-to-day lives. So let's take a moment to consider, how did you learn to become an adult? How do you learn to accomplish those everyday tasks of daily living? Well, most of us probably took maybe a home ec class. There's a lot of classes in the community now on adulting, and there's a bunch of books that you can order on Amazon. And I don't doubt that you could get some good information from these kinds of things. But what these things don't really do is replace those everyday, seemingly mundane experiences in our communities that not only teach us things, but give us the opportunity to practice and to make mistakes. So a few examples from my own life. When I was young, I worked at this grocery store in my hometown, and I took a second job at McDonald's. And through these jobs and balancing high school at the same time, I learned a lot of skills. I learned time management, how to prioritize multiple responsibilities, and it wasn't without mistakes. Sometimes I slept in too late, or the time I dumped 3 supersized drinks into someone's lap through the drive-through window. And those mistakes taught me how.
This is Allison Singer. I hate to interrupt you, but we are seeing your presenter view. We are not seeing your slide.
Sorry. Let's see if we can fix that.
I think you want to go to play from start.
Okay, hold on. How's that?
There you go. That's perfect. Okay. Thanks so much.
So what those things don't do is sort of tell us, how to navigate the experiences, like when I had to deal with a really angry customer because he was soaking wet. And so, and what about the times that you have to be patient? So when there's a growing line behind you and someone's digging for their change at the bottom of their purse. So fast forward to today, not only am I still learning from life experiences, but I actually have a lot of opportunities from our university to support me in my career. So there's faculty development programs, there's grant writing workshops, and all these supports are ongoing to make sure that I keep my job, even though I've already been successful at getting here. And of course, experience isn't just important to employment, it is important to everyday life. So look at marriage or parenting as another example. These are classes, or there are classes and books that we can take, but it's really the experience of being in those roles that prepare you to be competent in those things. So it's kind of ironic then when we look to supports for autistic adults that there's a lot of emphasis on manuals and programs. And there's a lot of exceptions out there. Certainly, TEACH is a program that provides lifelong supports for many individuals, as well as programs that are designed to provide opportunities throughout the day for many adults. And some embed community-based experiences, but they tend to be really time limited. And so the challenge with this is that while we have to be cost effective and these programs teach a lot of really important skills, we miss the research literature that reminds us that not only do autistic adults struggle in the transitions or finding a job or achieving some of these milestones, but they struggle to maintain their engagement in those roles as well. And yet there's a real gap in our understanding of the types of ongoing supports and so-called continuing education opportunities. So in the last little bit here, I want to talk to you about the Rutgers Center for Adult Autism Services, which has really been developed as a model for understanding the benefits and the approaches to these ongoing supports. So this is the new community center that's being built in New Brunswick. Hopefully will open this fall, even in spite of the pandemic. And the RCS really has a trifold mission to provide state-of-the-art services, to train the next generation of service providers and researchers, specifically to support autistic adults, and also to do research to advance our understanding of best practices. And so there's 3 programs associated with the RCAS, but I'm going to talk to you specifically today about the SCALE program, which is supporting community access through leisure and employment. So a key feature of the SCALE program is that the focus on integrating into the community. So Rutgers, like a lot of large universities, is really a community within a community. So there are many different job opportunities that you can find, really anything that you would like to do, ranging from libraries and food service to IT and management. And there are part-time jobs, entry-level positions, as well as full-time and opportunities for advancement. In addition, there's lots of different opportunities to gain everyday experiences in the community. So there's places to eat, there's green spaces, there's arcades and gyms to attend. And all of these things are really opportunities to not only be engaged in the community, but practice and learn skills in real life settings. And so in addition to being in close proximity to all these different sort of amenities, one of the advantages of being a Rutgers entity is that we have kind of a foot in the door with many potential employers. And being in an environment that's already intended to be inclusive, like the university, even if an employer doesn't know much about autism, they're open to learning. So another chance for us to kind of educate the community that we're in. And perhaps most importantly, we're in a setting that's already really open to doing research. So not just because research happens in the university, but also that there are lots of students and students can help support research. But a sort of advantage that I hadn't ever thought about before is that there's so many people on a college campus, at least during term time and outside of a pandemic, that when you are trying to support an autistic adult in the community, it's really easy to blend in. So if you have, students on campus are always in pairs or in small groups. And so when you're providing those one-on-one supports, it's less stigmatizing. But also if you need someone to do some observations or help with research, that it's a lot easier to blend into the surroundings. So right now we're providing supports to 12 adults on the spectrum, and they've been enrolled in the program for 1 to 3 years. And at least 10 out of the 12 had been continuously employed throughout the entire time in the program. Prior to the pandemic, participants were participating in anywhere from 10 to 30 hours of paid work across 15 different campus sites and 3 off-campus sites. And on average, participants were receiving about 4 hours per day, but that ranged from some individuals who needed one-on-one support 100% of the time to a couple of individuals who didn't need any supports in their actual job and just had occasional check-ins to problem solve very specific situations. So my favorite thing about the program, though, is that this extends beyond employment. It really focuses on community participation and opportunities to gain supports in gaining independence in transportation, opportunities to take advantage of some of the things on campus in terms of leisure activities and socialize. So all of the families have the opportunity to sign a research consent, so we can use all the information to track program details and individual outcomes. And we have a number of different specialty research programs that we also offer as opportunities for them. And so like many autism programs, we are tracking a variety of different factors and trying to understand what matters to achieving these outcomes. And so in this case, the continuous employment. So we aim to complete repeated assessments, and these are clinic-based assessments, and both standardized interviews, self-report when that's possible, as well as observational and direct testing. And of course, we track hours of support and the types of support. We literally have hundreds of pieces of paper that have every detail about the different supports that are being provided, broken down into 15-minute increments for billing purposes. And we have data on individual skills and the acquisition program. So if a participant needs support to learn a new job or a community skill, the BCBAs create a program and then they track how long it takes to acquire those skills and what kinds of supports they need to learn to do that independently. And as we collect all this data, we can really see changes in our clinic-based measures related to those real-world metrics. And I want to highlight one specific example, which I think is really important. So while the graph down here in the bottom left really highlights somebody whose hours are reduced and who never received a lot of hours on average each month, there certainly are participants who are maintaining higher levels of support and ongoing, even though we always strive to reduce and the overall level of support, overall level of face-to-face time hours if we can. And so, but what this is so important is that even though, at this time point when we first started, adults had already been into the program about a year or two, and we gathered information maybe 8 to 12 months later. And what we found is that they are showing gains in these measures, even these clinic-based measures, which really, I think, underscores the role of experience and ongoing supports can play in the continual development for them. And so not just focused on, that transition period, but well after the time that they started in the program. But really what's most exciting about this program, I think, is the opportunity to do research in this natural setting. So beyond the standard measures, we get to really examine those day-to-day details and what are the experiences that we miss using these standard assessments in the clinic. Beyond the number of support hours, how do we capture these positive achievements like friendships they establish, or this young man down here was awarded the employee of the semester for his work in his department. And so we capture not just the opportunities that they're benefiting from and the chance to develop new skills, but using this setting to really understand what are the kinds of experiences that they need to continue to gain skills and development. And so, you're probably asking, well, how do we do that? How do we do this research in naturalistic settings? And I think it's very fitting that I'm here in the Day of Learning to talk about this, because to be honest, we're really still learning. So one of the things that we're starting to try to do is to explore ways to integrate technology. So smartphones are a great way to incorporate prompts or to do little assessments throughout the day. Wearable activity monitors give us all kinds of data to examine factors that predict behaviors as well as responses to different environments and situations. And we can use machine learning and other data-driven techniques to really identify patterns and understand this complex data. But it's really important to highlight that while technology is very sexy and produces, bucket loads of data, this is really complicated data to actually interpret. So think about if you're interrupting somebody in the middle of their day multiple times to an ecological momentary assessment where you ask them what are they doing or how are they feeling right now, you're interrupting their day. And I think we need to know a little bit more about how that matters. The wearable sensors, looking at heart rate and different physiological indices, those are really complex sort of responses that can be influenced by a number of different things, sometimes not things that you actually care about. And so, we are trying to develop plans to integrate this as well as into the day-to-day lives, so that we can also pair this with direct observation and really understand not just the daily experiences, but hopefully yield some important information about the different approaches to research in naturalistic settings. And so I'll be honest that while the research in natural settings really is probably one of the most interesting pieces of my job, it's also far more challenging than doing research studies in the clinic. And part of the challenge there is the variability at every level of what you're trying to do. So there's variability across participants in the environment, what opportunities present in the day, and even a large extent how somebody is going to respond to that event might vary from day to day. And the trouble is that we have a real lack of measures to be able to look at this in any kind of systematic manner. So we have some of the technology, but we don't have standard observational assessments to do in these settings, even if we had more control over the environment. And there's a real need for a great deal of infrastructure to do this kind of research. People often say like, oh, you're so lucky you get to do research in the service center or in the services that you're doing. That must be a lot easier than recruiting participants. Well, it turns out it's not actually easier, because you're trying to deal with the day-to-day lives. You're not just bringing somebody in for a couple of hours. You're trying to find ways to integrate into their days without adding additional burden to your staff, to the participants, and to their families. And then figuring out also, how do you take that information and filter it back to actually provide information that will direct their supports and improve the programs that we're developing. And so, there's a lot of need for staff and time and funding to be able to develop these things so that we can accommodate the very personalized nature, which is the strength of the service program, but which is really challenging in a research setting. And all these things we're really working to do. And so even though there are many different challenges, we need to keep moving forward, hopefully increase awareness and appreciation for the need for this kind of research. I'll end with these two quotes to just kind of remind us of the importance of those sort of seemingly mundane experiences, and that we really need to understand the details of day-to-day life to support autistic adults, not just in their so-called transition to adulthood, but in an ongoing way throughout adulthood, to help ensure that they remain engaged in their communities. And so just a few acknowledgements. These are all the various colleagues and my team that are involved in this research, and a number of different people, but particularly the participants and the families who've really stood by us as we're trying to develop some of these research programs.